Dear parents, today we shall talk about a very common symptom, that's fever. So what is fever? Hello, I'm Dr. Sindhu, Chief Neonatologist and Pediatrician at Kaveri Hospital, Radial Road, Chennai. Dear parents, today we shall talk about a very common symptom, that's fever. So what is fever? We know that normal body temperature is 37 degrees centigrade. When temperature goes up above 38 degrees centigrade, we call it as fever. So why do we get fever? Fever is a manifestation of some infection or some inflammation in the body that the body responds by increasing the body temperature. It has two beneficial effects. One, the raised body temperature helps to fight against the infection, and it also tells us that something is abnormal, that we need to investigate the cause for fever. So parents often ask us, my baby's head is hot, is he having fever? So touching the baby's forehead and thinking that it is fever is a very crude method. Ideally, you should use digital thermometers at home. So the digital thermometers are the best that can be used in the axilla to accurately measure the temperature. Often we have seen at airports and in public places that people use the infrared or non-contact thermometers. They are not accurate, they are useful for mass screening, but they are not recommended for use in hospital or at home. So you should use a digital thermometer at home to measure your baby's temperature, and any temperature above 100.4 degrees centigrade is fever. So what should I do when my baby has fever? So carefully document your baby's temperature at frequent intervals. Keep your baby well hydrated, which means giving milk or food at regular intervals, adequate water to drink. Do not overdress your baby. And if the baby is sick or ill-looking, then you should visit your pediatrician immediately. So doctor, what are the danger signs that I need to look for in my baby? So the danger signs are, if the fever persists for more than 3 days, if the spike of fever is 104 degrees Fahrenheit or more, your child is not active, child has repeated vomiting, or is not taking food properly as before, or you have additional symptoms like fast breathing, inability to breathe well, or the baby is drowsy or has abnormal movements, then you should visit your pediatrician immediately and not wait. However, if you find that the fever spikes come down when you give antipyretics or paracetamol, the child is active in between fever spikes, child is able to take orally, then you can be reassured.